Hi, this is 5 Questions with an ISHLT member, and I am Jess Burke, Director of Marketing and Communications with the International Society for Heart and Lung Transplantation. And I am here today with Francesca Lunardi. Hi, Francesca.
Hi, Jess. Thank you very much for your kind invitation.
Well, thank you for joining me. Before we dive into our 5 questions, I guess I'll ask you the question 0, which is, do you mind sharing who you are, what you do, and what your role is with ISHLT?
Okay, first of all, it's a great pleasure to be here with you. So let's start with this, your first question about myself. I'm Francesca Lunardi, and I have been working at the pathology unit at the University of Padova since 2005. I started working here as a molecular biologist, and I was involved in different research studies on thoracic diseases. After obtaining PhD, I started studying medicine and surgery because my love for medical sciences and in particular pathology was growing up, and now I am a pathologist trainee. Concerning my role in ISHLT, I'm the pathology community representative in the early and trainee committee.
Fantastic. Yes, and that's how we got to know each other, was through early career and trainee committee. It's been a pleasure having you in that group. So you talked a little bit about your love for medical science and pathology. What got you involved in ISHLT and what keeps you involved with this community?
Well, I got involved in ISHLT because one of the main research fields is lung transplantation. In particular, I have been participating in different clinical and experimental studies that focus on new perfusion systems for donor lungs, as well as mechanisms related to the main post-transplant complications, such as primary graft dysfunction and CLAD. Moreover, after my degree in medicine and surgery, I started to involved also in the pathological post-transplant monitoring of patients, so thus I have become even more interested in growing my knowledge and expertise in lung transplantation. Moreover, 1 year ago, I had this great opportunity to be actively part of the society as pathology representative, and I'm here and very honored to be here.
Absolutely. So what inspired your career path? How did you discover that you wanted to be in medical science? How did you discover you wanted to be a pathologist? How did you get there?
Well, I can tell that my career started in 2000 when my mother found some information about molecular biology degree and encouraged me to consider it. I had just finished the high school and I didn't know what degree I would have chosen. So I followed her suggestion, and as I have always done in my life, and I've been very, very happy and satisfied. In 2005, I met the person who really represents my career inspiration, that is Professor Calabrese. She has been fundamental in all my path decisions, and she has given me the possibility to follow the dream that was growing in me, that was to become an academic pathologist. So I can tell that my love for pathology was born when I met Professor Calabrese.
I like that there are 2 women. Your mother was the first who inspired you to follow your path. I think it's really lovely. So tell me about a meaningful milestone, whether that's in your personal career or in the field of pathology, that you feel really excited about, that you'd like to share.
Now, I think that the most important milestone from a work point of view, from academic point of view, is the day of my degree in medicine and surgery, because I graduated almost 3 years ago, and all my family and dearest were with me, as well as my mentors, so Professor Calabrese and other very important people for me. In particular, there was my first child, Emanuele, that was in hand with me in front of the commission when the degree certificate was given to me, and it was a really an important day for me, not only from a professional point of view, but mainly because I was very proud to be there with him, and I will never ever forget it.
Yeah, that's a lot of joy in one place. That's a special moment.
Yes.
So when you think about the future of your specialty, it's been several years since you finished your training, you're really involved in it now. What do you see on the horizon for pathology and treating lung disease?
I think that pathology will become even more important in the heart and lung transplantation field. Indeed, the pathologists must be always included in the multidisciplinary monitoring of patients from the waiting list up to the post-transplant long-term follow-up. Indeed, I think that our contribution is fundamental for a more comprehensive view of the patient and his best management. So I love pathology. I don't know if you see it. And I think that this community, these specialists should be included even more in the monitoring and in the following up of patients.
Absolutely. And I think that one of the gifts of ISHLT is the multidisciplinary nature, that people are able to look at other specialties and learn from one another. So I think that's a good message to share. So talking a little bit more about you, when you're not looking in the microscope that you have next to you, what are you doing? What's your idea of a perfect weekend?
Well, I think that my perfect weekend is absolutely on the beach, looking at the sea waves and hearing the big noise done by my children, Emmanuel and Aurora, that represent the other dream that I have realized. And I think that is could be my perfect weekend.
That sounds great. Right now, as we're having this conversation, it is snowing in Chicago. So I think I'm on my way to Italy to join you at the beach. That sounds pretty good.
I hope so.
Well, Francesca, thank you so much for taking time to chat with me today and share some of your thoughts with the ISHLT community. Is there anything else you want to share with them that we haven't covered today before we go?
And I would like to see a lot of people in Boston in the next ISHLT Congress. I hope that we will be able to be in person and for sharing and for sharing and not only very important advances in the heart and lung transplant field, but also to share some other things and to stay together.
Absolutely. Well, I can't wait to see you there, and I'm counting down to Boston too. Thanks so much, Francesca.
Thank you, Jess. Thank you very much.